If you use infusions, injectables, or any other high-cost medications to manage your health, you may be familiar with CoPay cards. However, you might not be familiar with CoPay accumulator programs. Let's start with a refresher on some health insurance terms. Your deductible is the dollar amount you pay for health services or medicine before your health insurer picks up the bill. Copays and coinsurance are separate costs from your deductible. A copay is the dollar amount you pay a healthcare provider after getting a service, like a checkup at the doctor. Copay amounts differ depending on your health insurance plan, but should be the same amount for each visit. While a copay is a set dollar amount, coinsurance is a percentage you pay of the total price of the medicine or service. Coinsurance and copays are both out-of-pocket costs, or the amount that you are responsible for paying. Your out-of-pocket maximum is the maximum limit for your personal health care costs. Once that maximum is met, your insurance should cover your health care expenses for the rest of the year. This is where a copay card comes in. Copay cards can take the form of coupons, cost share assistance, manufacturer assistance, or any other third-party copay contribution. Basically, someone other than you pays for a part of your copay or coinsurance with a copay card that works like a gift card or a debit card. However, as copay cards have become more common, insurance companies have responded with copay accumulator programs. These policies block copay cards because they do not allow payments made with copay cards to count toward your out-of-pocket responsibility. For example, meet Nikki. Nikki has Crohn's disease and receives an infusion every 8 weeks. She gets her first infusion of the year and then gets an explanation of benefits, which explains what cost her insurance company will pay. 2 weeks later, Nikki gets a bill from her infusion office for her cost responsibility. Nikki's infusion cost $1,000, and the explanation of benefits says her insurance company will cover $500. So Nikki must pay the remaining $500. Since Nikki is in a cost share assistance program with the company that makes her drug, she can use a copay card to cover the remaining $500 she owes. This means that Nikki will not have to use any of her own money to pay for her infusion. Nikki has a $1,000 deductible and a $3,000 out-of-pocket maximum. So after her third infusion of the year, she believes she has reached her $3,000 out-of-pocket maximum, and her insurance should cover her remaining healthcare costs for the year. Then, unexpectedly, Nikki gets a bill for $1,500. Her insurance company says that because she used a copay card, she did not meet her out-of-pocket maximum. According to the company's copay accumulator policy, payments made with her copay card do not count toward her out-of-pocket maximum. Even though Nikki's copay card is backed by real money, her insurance company does not count payments made with it toward her deductible. Not only is Nikki stuck with a $1,500 bill, but she is also responsible for paying for part of her next infusion. Unable to afford this, she skips her next treatment, leading to a flare-up that puts her in the hospital. So why don't insurance companies want you to use a copay card? First, copay cards allow people to reach their deductibles and out-of-pocket maximums faster, which means insurance companies must pick up their part of the bill sooner. Insurers also claim that their copay accumulator policies encourage patients to use cheaper, generic alternative medicines. But for many patients who rely on specialty medications like biologics, there are no generics. Under copay accumulator programs, infusion patients are pushed to pay for treatment without copay cards or go without treatment. So, how can you tell if your insurance plan has a copay accumulator program? Read your health insurance plan, visit your insurance company's website, or call the number on the back of your insurance card to access your plan benefits. You can also look at your explanation of benefits or EOB statement, which you likely received after your last treatment, to see how much your CoPay card counted toward your last treatment. Currently, Blue Cross Blue Shield, Cigna, and United Healthcare have CoPay accumulator programs. But don't be fooled, because they are sometimes disguised with patient-friendly names such as Cigna's Shared Savings Program or United Healthcare's Coupon Adjustment Benefit Plan Protection Program. Thankfully, some states are taking action to stop CoPay accumulator programs. The green states on this map have banned CoPay accumulator policies as of 2022. If you live in one of these states and have been impacted by a CoPay accumulator program, your insurance company may be breaking the law. Let your state's Department of Insurance know as soon as possible by filing a complaint online. It is important to understand that these state laws do not protect people with employer-sponsored health plans, health insurance you get through your job, which are managed by federal law. If your state does not have a CoPay accumulator program ban, IAF encourages you to call your state-level representatives or send them an email through IAF's online grassroots campaign. You can also join the Infusion Champion team on our website to connect with other advocates and receive action alerts. Lastly, consider sharing your story with IAF by telling us how a CoPay accumulator program impacted you. We hope this information was helpful. If you have any questions, please contact us.